Hi. Supraventricular tachycardia is an irregular or fast erratic heartbeat that affects the heart's upper chambers. SVT is also called supraventricular tachycardia. A typical heartbeat is about 60 to 100 times a minute. A heart rate of more than 100 beats a minute is called tachycardia. During an episode of SVT, the heart beats about 150 to 220 times a minute, but it can occasionally beat faster or slower. Most people with supraventricular tachycardia don't need activity restrictions or treatment. For other lifestyle changes, medication and heart procedures may need to be controlled or eliminate the rapid heartbeat or related symptoms. Types. AVNRT, the most common type of supraventricular tachycardia. Also, AVRT, the second most common type of supraventricular tachycardia, is most commonly diagnosed in younger people. Atrial tachycardia, a type of SVT more commonly diagnosed in people who have heart disease. Atrial tachycardia does not involve AV node. Other types of supraventricular tachycardia include sinus tachycardia, SNRT, SIT, JET, sorry, I have to turn the page, NPJT. Symptoms. The main symptom of supraventricular tachycardia is SVT is a very fast heartbeat, 100 beats per minute or more. That may last for a few minutes or to a few days. The heartbeat may come and go suddenly with stretches of a typical heart rates in between. Some people with SVT have no signs or symptoms. Signs and symptoms of supraventricular tachycardia may include very fast, rapid heartbeat, a fluttered or pounding in chest, palpitations, a pounding sensation in the neck, weak or feeling very tired, fatigue, chest pain, shortness of breath, lightheadedness or dizziness, sweating, fainting, or near fainting. In infants and very young children, signs and symptoms of SVT may be very difficult to identify. They include sweating, poor feeding, pale skin, and rapid pulse. If your infant or young child has any of these symptoms, ask your child's care provider about SVT screening. When to see a doctor? People, I am not kidding when I say this is serious. Supraventricular tachycardia, or SVT, is generally not life-threatening unless you have heart damage or other heart conditions. However, in extreme cases, an episode of SVT may cause unconsciousness or cardiac arrest. Call your healthcare provider if you have an episode or a very fast heartbeat for the first time, or an irregular heartbeat for the last longer than a few seconds. Next page. Some signs and symptoms of SVT may be related to serious health conditions. Call 911 or your local emergency number if you have an episode of SVT that lasts more than a few minutes. Or if you have an episode with any of the following symptoms: chest pain, shortness of breath, weakness, or dizziness. For some people, a supraventricular tachycardia SVT episode is related to an obvious cause trigger, such as exercise, stress, or lack of sleep. Some people may not have a noticeable trigger. Things that may cause SVT episodes include heart disease, heart failure, other heart conditions such as Wolff-Parkinson-White syndrome, chronic lung disease, a lot of caffeine, too much alcohol, drugs misuse including cocaine and methamphetamine, pregnancy, smoking, thyroid disease, certain medications including asthma medication and cold and allergy drugs. The heart is made of 4 chambers: the 2 upper chambers, atria, and the 2 lower chambers, ventricles. The heart rhythm is controlled by the natural pacemaker, the sinus node, on the right upper chamber. The sinus node sends electrical signals that typically start each heartbeat. Those electrical signals move across the atria, causing the heart muscles to squeeze, contract, and pump the blood into the muscles. Next, the heart signals arrive in a cluster of cells called the AV node, where the signals slow down. The slightest delay allows the ventriculars to fill with blood. When the electrical signals reaches the ventriculars, the chamber contracts and pumps blood into the lungs or the rest of the body. In a typical heart, this heart signaling process usually goes smoothly, resulting in a rest heart rate of 60 to 100 beats a minute. SVT occurs when the faulty electric connections to the upper heart set up a series of early beats in the upper chambers of the heart. When this happens, the heart rate speeds up very quickly. The heart doesn't have enough time to fill with blood before the chambers contract. As a result, you may feel lightheaded or dizzy because your brain is not getting enough blood and oxygen. Risk factors. Supraventricular tachycardia, SVT, is the most common type of arrhythmia in infants and also in children. It also tends to occur more often in women, particularly during pregnancy, although it may occur in anyone. Other things that may increase the risk of supraventricular tachycardia are age. Some types of SVT are more common in people who are middle-aged or older. Coronary artery disease or other heart disease are previous heart surgery. Narrowed in the heart arteries. Heart failure, damage to the heart artery valves, combopathy, and other heart disease may increase the risk of developing SVT. Congenital heart disease. I totally didn't butcher that name, but it's fine. Having heart problem presented at birth. Irregular heartbeats such as SVT. Thyroid disease. Yikes. Having an overactive and underactive thyroid gland can increase the risk of supraventricular tachycardia. Diabetes. The risk of developing heart disease and high blood pressure greatly increases the uncontrolled diabetes. Obstructive sleep apnea. This disorder is which breathing is interrupted during the sleep can increase the risk of supraventricular tachycardia. Nicotine and illegal drug use. Nicotine and illegal drugs such as amphibians and cocaine may trigger the episode of supraventricular tachycardia. Complications! Yay! Over time, and untreated and frequent episodes of supraventricular tachycardia, SVT, may weaken the heart and lead to heart failure, particularly if there is no other medical conditions. In extreme cases, an episode of SVT may cause unconscious or cardiac arrest. Keeping the heart healthy is important to step in preventing SVT. Eat a heart-healthy diet. Don't smoke, get regular exercise, and manage stress. For most people with supraventricular tachycardia, moderate amounts of caffeine do not trigger an episode of SVT. Large amounts of caffeine should be avoided, however.
SVT can be dangerous, so be careful.